is Halloween, and I have to remind myself not to eat too much candy, but that helps to remind me to talk a little bit about diabetes. We all, myself included, have a tendency to overeat. Diabetes is seen in animals that are overweight, and it is a big issue, especially with dogs. We also see diabetes in cats, but the primary pet that we see is in dogs. In dogs, it's caused from one of two things. One is the lack of insulin production, and that's because there's been damage to the cells in the pancreas, which is the organ responsible for producing insulin. And this is thought most likely to be due to what's called an immune-mediated issue. Basically, the animal's body is fighting against its own normal tissue. The other type of diabetes we see doesn't deal directly with insulin. It deals directly with the lack of production. And that's associated from birth, and it's non-insulin dependent diabetes. It can actually be a combination of both, but what we just want to primarily remember is that with diabetes in dogs, it's an insulin issue. We do see it, again, in overweight animals. One of the most common signs that we see, though, are that they urinate a lot and they drink a lot of water. And that'll be a common complaint we get from people. And the animal, if they're thin sometimes and very hungry, this is, again, another indicator that this dog may be diabetic. We have to also rule out urinary problems. If we have a bladder infection or a lower urinary tract problem, then we're going to also see an animal that will drink lots of water and urinate frequently. Testing is very straight up. It's basically simple, complete blood panel. In that, we'll look for functions not only of the pancreas, of the liver, but also of what the glucose or the sugar level in the blood is. In diabetic dogs, we can see very high elevations of glucose. Urinalysis is the other key test that we do use. We'll be looking for we'll be looking for glucose in the urine, and we'll also be looking for another compound called ketones. When the body's not producing enough insulin to derive enough energy in order to function appropriately, it will start to break down protein in the body. That means muscle mass. And we'll see a lot of severely diabetic dogs that are thin. Their muscle mass is getting very small. They look like they're just wasting away. But since the body thinks that it's starving to death, it's not getting enough energy, it actually takes protein out of muscle. And one of the byproducts are going to be ketones, and the ketones are found in the urine. So that tells us, again, the degree. We know we've got a diabetic because we have glucose in the urine. We have ketones in the urine, so we know it's a severe diabetic situation. And we've got glucose that's showing up in the blood itself, in the blood values. Basically, those are the diagnostic tools that we do use. Treatment is done by insulin. It can be once a day, twice a day. In people, they actually have pumps where there are small amounts of insulin that are provided to their bodies throughout the day. But with dogs and cats, we give them insulin in the morning, insulin in the evening, and then want to feed them between 30 minutes to an hour after they have had the insulin in order to provide the food once the insulin is given. Give the insulin, it's going to take the sugars from the meals and put it to work in our bodies. Management of diabetes can be very challenging. We have to do multiple blood tests to determine whether we're continuing to maintain that glucose or that blood sugar level, and it's in appropriate amounts. Sometimes we cannot use once a day insulin, we have to do twice a day insulin. Simple at-home testing can be done once they are stabilized. We use, and I have a couple of those tests that we do use, is a blood test and a urine test. The blood test is the same thing as used in humans, but this one is calibrated for use in dogs and cats. It's just a program setup that we do within the software of the equipment. And these glucometers are available. Some people do have their own for their own diabetics animals at home, but they use the same kind of little test strips that go in the machine, and it gives us a reading. And it's just seconds. It's very quick. This is kind of an older method. We're using dipsticks. These dipsticks they're going to give us glucose plus a lot of other information. They do have simple ones that are just for glucose and ketones in the urine, and these are best done in the morning to tell us the status of whether we have a lot of glucose in the urine or we have ketones. As far as the ketones, which is again an indicator of breaking down of protein in the body, the glucose is probably the best test strip to use under those circumstances. For people who can't use the glucometer, as we said about their blood test, with a small stick and a little testing equipment, the urine dipsticks are one way that can be done. Long-term diet is very, very important. We have to maintain a carbohydrate. Carbohydrates are one of our biggest issues with diabetics. We want to manage that, but the difficult thing anytime you're trying to manage a disease with diet is balancing the nutrition. Specialized food is available in the veterinary industry. There's 3 primary manufacturers, and that's Purina, Science Diet, and Royal Canin. These diets aid in the treatment and control of diabetes, and if done properly, these animals end up living a perfectly normal life.